talking, you don't have to check that. Okay, so we stopped here, right? We stopped here, right? Who's the person who's gonna communicate with me today? I need a lucky person, anyone, even someone from last week. I don't mind as long as y'all are voluntary. Any volunteers?
Yes, sir.
Yeah. What's your name?
I'm Lakshana.
Archana.
Lakshana.
Lakshana. Okay, right. Lakshana is going to start volunteering. Right, Lakshana. Now, let's imagine that you are one of the what do you call these? You're in one of the you're a first aider in an ambulance, right? You are called in the scene where a person who has gone shopping has just automatically fallen on the ground, and these people have quickly called you. Now you're rushing, right? Imagine that this is a part of this is in the main road, right? In the main road, you have come, that is your vehicle. Imagine that is a 1990 vehicle, and you're running towards the patient. What are the things that you do? You have two more people. What are the things that you would do?
As you were saying, we can just press his sternum and see whether is he alive or not.
Okay. Before that, will you do anything else?
Can call for helps from those who are standing nearby.
Okay, you're going to call for help from those who are standing. That is why this is exactly where I want to teach you all to think on your feet. What did I tell? What did I say? What are you? I said you are a first aider, right? You are a first aider. You come with a team, right? So you've forgotten that. You're like asking for help from the general public. No point. No. You
Yeah.
itself know this thing. You have a set of people. You will do that, right? And that is one. Second thing is, you are called so that you are called for help. So you calling for help for them is wrong. So what you need to do is you need to quickly assess, quickly put him in the ambulance and take him over. That is your main function. You have to take him to the hospital as soon as possible. Because as I was explaining last week, most of the patients die because we don't bring them early to hospital. That's the biggest reason, right? So you basically said you will come and check for response, which is okay. But before that, what did I teach y'all? What was the way that I told you? D R A B C. So you went straight into R. Did you check D? Exactly. So most that is why I said this is in the main road. So you, with the help of your partners or colleagues, you slowly move him to the side of the road so that you know you are not in danger. The patient itself is not in danger. Then you bring a spinal board or whatever. You check for response. Obviously, if he's responding, talking, saying that I'm just feeling faintish and I automatically fell, or I'm a diabetic. I'm a diabetic and I had not eaten anything. I had just taken my diabetic drugs and he fell, so he was having a hypoglycemic crisis. So you can give him something. If he's talking, you can give him something sweet, put him in the spinal board and take him in the ambulance, right? That's all, right? So now let's imagine, now you went and this thing, you went and actually spoke to the patient, right? And you check for response. He's not responding. Imagine this is you. He's not responding. This is how you check for response. You hold the person from there, and then are you awake? So if he's not responding, what else would you do? Then shall we have, okay, we'll change the scenario in such a way that this is, you're not a first aider. You're one of these guys who are just standing next to the tree, right? And you have just you have like, let's just say that you have been a part of my lecture, therefore you know what first aid is, and therefore you have made sure that the patient is safe, right? And brought the patient aside, and the patient is not responding, and then you call for help. You will tell someone else on the side to call 1990 and tell them to come because this guy is not responding, right? And then you start off with Yahweh, right? Because remember, D R A B C, right? So you've sorted D, Now response is not responding, and now you check if the Jave is free. So usually what happens? Sometimes the Jave can be blocked, right? The Jave can be blocked. So what are the causes of Jave obstruction? Usually foreign body. So sometimes if the person has met in an accident, or if the person has vomited, or the tongue. The tongue is the biggest thing. Tongue can actually fall off, right? Because when the person has lost consciousness, the reasons, the very common reasons why the Jave can get obstructed is this. So what you have to do is you have to open the mouth and you have to see if there is any obstruction. There is any foreign particles or foreign bodies, like any pieces or anything. Is there any vomit? You need to clear it. Tongue, you can't pull the tongue out now, but there is a maneuver which we call chin lift, right? Head tilt, jaw thrust, right? So what we do is we tilt the head, right? We thrust the jaw upwards and we lift the chin up. So it's called head tilt, chin lift, jaw thrust, right? It's called a triple Jave maneuver. This will ensure that we open up the Jave. This will ensure that 100%, like in a sense, like the patency, that you imagine the Jave of the mouth connecting into the nasopharynx, oropharynx, and going into the trachea. It's like a, let's just imagine it's like a tube, an Eslon pipe, right? So what by doing this maneuver, you are making sure that this Eslon pipe is patent. Like you are making sure most amount of air can go in so that he can breathe easily. So that, and also the triple maneuver, especially the jaw thrust, where you lift the jaw upwards. That is to ensure that the tongue doesn't fall back, right? So head tilt and chin lift just widens the Yave so that he can breathe easily. Jaw thrust will prevent the tongue from it falling back. Right. So when we start having our practical classes, I will actually get a mannequin and I will show you how this is done. How do you do a chin lift? How do you do a head tilt? And how do you do a jaw thrust? Right? Any questions so far? No questions. Okay, great. Right. So then how, right? Now you've done this. Let's just say that you have learned something and you've done this. So by doing this, does that mean the patient is breathing? Lakshana?
So can you repeat the question again?
Yeah. So now you have done this Yave maneuver. This Yave maneuver is done to see if the Yave is patent, right? That means if there is enough air that is going in. But does that mean after you do this, does it mean that the patient is breathing?
Yes.
Yes. Okay. Anyone else?
No, so we can't say exactly, right?
We can't. We can't exactly say it. So how do you check if the person is breathing? After doing all of this, we will not know. It will just make sure that the patient breathing, he has to breathe. He has to breathe on his own. So just because you do this does not mean that the patient will be breathing. But how do you check if he is breathing? As you can see here, chin lift, a better representation of the triple Yave maneuver. Chin lift, head tilt, jaw thrust, right? So chin is lifting the chin from the tip, right? From the mental process, you lift it up. From the head, you tilt the head, right? And the jaw thrust is to prevent the tongue from falling. That is why it's called a triple Yave maneuver. There are three things that you need to do: chin lift, head tilt, jaw thrust, right? So now look at this algorithm, right? We'll go again or check for breathing, right? You see the patient, he's not responding. You now D, danger, where you've made sure that you and the patient are safe. R, response, he's not responding. Then you check for Yave. You see if the Jave is clear and open. If the Jave is clear and open, there is nothing to worry, right? You check for bleeding. If the Jave is blocked, right? So you can roll the casualty into recovery position, right? Which I will discuss later. Recovery position is in the left lateral side. I think one of you all know about it. Turning him on the left lateral side and clear and open the Jave, right? So when that is blocked, you can actually turn him on the left side and actually you can do the chin lift, head tilt, jaw thrust. But sometimes even if the Jave is open, you can still do this triple Jave maneuver. That is the chin lift, head tilt, jaw thrust, and then you check for bleeding, right? If the patient is breathing, how do you check for bleeding is another question. You check if the patient is breathing or not. If the person is not breathing, right, then you check for the pulse, right? This is again, don't look into it. You check for the pulse. If there is no pulse, then you start CPR. But if the breathing is present, you leave the patient in the recovery position, and you keep doing the triple Yave maneuver, right? If you have anyone else there to see for like, who can help you, tell them to do this, and then you check for other things, which I will explain, right? So now, how do you check for breathing is the question. How do you check for breathing? Is there any way?
So keep the hand nearby his nose.
Okay, and feel if there is air going in and out, correct?
Yeah, so
Okay, good that you thought about it. Now, breathing also, there are three things that we will check, right? It's called look, listen, and feel. So, one thing that you just said was about the feeling, but not using the hands, but using the cheek, right? I'll show you now, right? Look at this. This is a representation of look, listen, feel. Can someone explain where it is look, listen, feel? How you can understand look, listen, feel here? She's using her eyes to look if there is any chest movement, right? If there is any chest movement, that is the look part, right? If when you breathe, your chest moves up and down, right? Second, she's keeping her ears and listening if she can hear him breathe. That is listen. And then she's going to keep her cheeks close to the nostrils if she can feel any air movement. That is the feel. So this is a triple assessment for checking how if the person is breathing or not. Right here. Check for breathing, kneel down and put your cheek close, right, to their face. Can you feel the breath on your cheek? See their chest movement or hear them breathing? So there are three things. Feel the breathing of the cheek, which you mentioned. See the chest movement using your eyes, or you hear them breathing. So you look for chest movement, listen for sounds of breathing, feel the breath of your cheek. So look, listen, feel, right? And if the person is not breathing, you can give two rescue breaths. But in your level, don't remember that. That's not important because you don't know what that person has. You don't know if he's having any conditions. So don't go to that. But if he's not breathing, you check for the pulse, right? So you can't check for the radial pulse, which is in the hand. You have to check for the pulse in the carotid. So that is in the neck. And if you feel, you basically put your index and middle finger. You can't use your one finger. You take two fingers and you put it on the side of the hollow between the Adam's apple and the neck of the muscles. There is a muscle called the sternocleidomastoid muscle. You feel it and you press and you feel if there's an artery. Have you ever felt a pulse before? Anyone? None of y'all have ever felt. So I think best thing is right now during the class, just take your hand, two fingers, that is your index and middle finger, Put it on your side of your neck and feel your carotid pulse. And let me know if you feel a pulse. Very important. There is a hollow between the Adam's and mastoid muscle. Is anyone feeling it right now?
Yes, sir.
Yes, sir.
Right. So it's great that you can, because you need to feel it at that time. Because sometimes you can't say, oh, I don't know exactly where it is. It's very important, because that is going to decide. If there is no pulse, that is going to decide whether you will start CPR or not. You will start cardiac massage or not. Right? So you need to check if there's a pulse. Is it strong? Is it regular? Is there major blood loss? Then, if the patient is not actually not having a pulse, you start CPR, where you need to, get on the left side of the patient and start cardiac massage. So how do you do cardiac massage is again a very important thing. You need to make sure that your hands are straight. You need to place the heel of one hand in the center of the chest, right? Place the other hand on the top. So usually your dominant hand, if you're a right-handed person, your dominant hand should be on the bottom. Your non-dominant hand should be on the top. You interlock your fingers and compress the chest. Now, when you compress, you need to make sure that your arms are completely straight. If you can see in this diagram, right? The arms are straight, right? He's using his body to provide the force, right? When it's compressed, what happens is you get tired very soon. It's very difficult. Sometimes, this is like a proper workout, right? It's very difficult. Sometimes you need to go on for around 20 minutes, like a digger, so it's very tough. So you need to ensure that you try your level best in ensuring that you do it in the most easiest way, so that you can go for that long. Understood, right? So there are a few other things that you actually need to do. You
Excuse
need to
me.
compress at, yeah, go on.
I have a very small question. Let's say
Yeah,
we're doing CPR on somebody, and let's say the person who's doing CPR can't go on for 20 minutes, and if they have to stop and
yeah.
give it over to another person, would that affect the patient?
Obviously it's going to affect the patient.
Yeah.
There is definitely no doubt that it will affect the patient. But the thing is this. Now the thing is, you can't, if you are on the road, let's just say, now again, we have to look at it very practically.
Yeah.
You are on the road, you find a patient who is actually, he's not having a pulse, and you
Mm,
decide, okay, he has arrested. You
mm,
start CPR, but at
mm.
that same time you call for help. You
Yeah.
tell them to
That's
call for an ambulance.
yeah. So
Until that time, yeah.
yeah. So if the medical help arrives, is it
Yeah,
okay for me to interrupt, like stop the CPR that
yeah,
I'm doing and give it over to them? So in that little gap of
so
the CPR stopping, would it
yeah,
affect
there
the
is
patient?
no, so that's the thing. It is affecting. So there are ways that we actually take over, because
Oh, okay.
the compressions have to be done in the ratio of 30:2. So you do give 30 chest compressions, and then you give two good ambu ventilation. So as soon as the medical team comes, they will take over, and they will take over in such a way where you will realize that there was very little delay. You understand? The delay is definitely going to be there. It's good that you understand that you switching over with another person is going to affect them. Now, what is the point of CPR? What's the point? Does anyone understand why we do CPR?
To jolt the heart into beating again?
No, it's not at all to cost, because the heart has stopped beating because of a reason. So by just pressing it, yes, there can be sometimes a reason, but this can be, like, I would say, 1% of the reason why the heart would automatically start beating. But it's got more to do with what? It's basically, we are basically as an external factor that is compressing the heart. Now, what is the most important thing when a person goes into cardiac arrest, right? The heart stops beating, right? The heart stops beating. So when you do cardiac massage, right? If you do good cardiac massage, you're squeezing the heart. You're squeezing the heart and you're relaxing. When you lift your hands up, you're relaxing. So what is that? That's like a heartbeat. So this will ensure that blood is going to go into the main parts of all the important organs, right? If a patient is arrested, the heart is not beating, that means the brain is not going to be getting any blood, right? That means the brain is not going to get any oxygen. None of the lungs is not going to get anything. So you have to understand the whole process is you're basically buying time. By doing CPR, you're buying time so that this person's heart will automatically beat. And then when you take him to the hospital, the people will try to figure out as to why this has happened. It can be a heart attack, it can be because of hypoglycemia, it can be because of severe blood loss, so these are the reasons. So without you treating all of that, the heart is not going to start beating on its own. Sometimes there can be a ventricular fibrillation, right? So for that, you need to give him a shock, like defibrillate, right? So it all depends on what exactly is the condition that caused him to go into arrest, right? So all of this time, you are just buying more time. You're making sure that there is enough blood that is going all around the body, and that is what you are doing, right? That is the main reason why you have to do CPR. That is why we keep on doing CPR, and we make sure that we don't, because we know that the nervous system, especially the brain, is very sensitive when there is no oxygen. And therefore, when there is no oxygen, they will definitely deteriorate. Understood? Right? So that's the reason why we do CPR. So when there is a slight delay, when you switch over, when there is a slight delay, obviously it's going to affect. But we do it in such a way, even in the hospital, we do it in such a way where you'll be like 1, 2, 3, I'll be taking over. When he finishes his 30, as soon as he's done, and the other person is giving him the rescue breaths or the ambu ventilation, you quickly place your hand and start doing CPR. You understand? So sometimes when we check for the rhythm, right? Rhythm checks, we actually do CPR. Like in a sense, we wait, and then we connected him to the leads, right? To see on the cardiac monitor to see if it's a shockable rhythm or a non-shockable rhythm. It's a little extra for you all. But remember, there is this thing where I told you defibrillate. You use a defibrillator to defibrillate, right? To give him shock. I'm sure you've seen it in movies. So that is not given for all conditions, but there are some rhythms. So when the person is giving CPR, you can't check a rhythm because at that time the rhythm is affected by the fact that you're giving cardiac massage. So there will be a small time interval, like less than 2-3 seconds, where you quickly lift the hand and you check for the rhythm and you see if it's a asystole. That means if it's a straight line or is it a irregular rhythm. If it's a asystole, you continue CPR. If it's a irregular rhythm, you have to give a shock. And when you have to give a shock, you tell the patient to again tell the person to again do CPR, and then you place the pads, and then you try your level best to minimize the time gap. So that's absolutely true. All right. I hope I answered your question. Right. So I said you compress the chest at the rate of 100 to 120 beats per minute. So that means you press around 100 or 120 times a minute. You should press deep. It should go around 5 to 6 centimeters, because you need to completely press the heart. Right? The whole point is so that the heart gets compressed and the blood can actually go all around. Right? And there should be equal time interval for compression and relaxation. Right? So when you compress, right, you need to relax, because if you just keep on pressing, what's going to happen? The heart is never going to go into diastolic phase. I'm sure you all know what diastole and systole is, right? That means the heart is never going to get blood in receiving the blood, because the heart needs to receive the blood to send the blood all over the body. So if you just keep compressing, it's like a balloon without just with, like, if there's a balloon connector, just imagine there's a balloon connector and you have pipes all around. That imagine those are the inferior vena cavas and the arteries, right? And you keep pressing without waiting for it to fill up. What are you going to be giving? There's nothing. It's empty. There's nothing that's coming in, right? So you need to give time. You compress and you relax. You compress, relax. You compress, relax. Right? I can't show it to you right now, but if the mannequin was there, I could have easily shown you what is the difference and how much it will affect. So hopefully when we start our practical classes, right, or we might have a class where I will get a mannequin and I'll turn the video on, and we shall do this. Maybe, hopefully, not this week, not next week, but the week after, we'll try to actually arrange that, even if we can't do it. And look, this is the third point. When possible, change CPR operator every 2 minutes. Can you imagine? So why does it happen? Because you get tired after 2 minutes. When you get tired, the efficacy or the efficiency of your CPR reduces. And when the efficiency of the CPR reduces, that's not good for the patient, right? So these are the reasons as to why, it's very, very quite essential, where you need to make sure that you do it well, but you do it properly, right? So as you can see, the guy is actually continuing CPR, right? And now you might ask, when do you stop, right? So when do you stop CPR? When the patient starts bleeding, right? Someone else, like for example, like 1990 comes over and takes over. In AEDs, if you put a defibrillator and they say that you have to shock the rhythm, go and shock. So that is when that is that. The scene becomes unsafe. Automatically, there is explosions all over. You leave, because you at that moment of time you have to make a judgment call. You have to say this is going to affect you. You have to leave, right? And you are physically unable to continue. Let's just say that you are somewhere in some dote area, right? And you have called. They said it will take 10-15 minutes. You manage to do CPR for 10 minutes, and then you can't. You are not. You can't. So you just wait. You rest up a bit and you do it, because if you are the only person who is there. So these are the ways. These are when you have to. So obviously the guy's risk is going to be compromised, but you can't help it. Any questions? Right. I want to do another scenario with you all. Right. So look how essential CPR is. Right. CPR saves lives. About 400,000 cardiac arrests happening outside of hospitals each year in the United States. Right. Just hands only CPR can double or triple an adult patient's chance of survival. A person who has undergone CPR before coming, if he has arrested and he's done undergone CPR, it will improve his chance of survival 2 or 3 times, right? If you act quickly, at 4 minutes without oxygen, permanent brain damage sets in. This is why we do CPR. So that at least that way the blood is actually going into the brain. That is, oxygen is going into the brain. At 8 to 10 minutes without oxygen, death can occur. 89% of the out of hospital cardiac arrest patients die because no one on the scene gave CPR. This is how significant cardiac massage is. Any questions so far? Okay, I want another person, and we are going to go through another scenario again, right? Same scenario, but I want you all to again get very familiarized with this. Who's volunteering?
Me,
Yeah, what's your name?
Zahara.
Okay, Zara. All right, Zara. Imagine that you're on the road, right? And you find this particular gentleman fall on the ground, right? But he's bleeding from one side of the leg, right? And there's quite a lot of bleeding, and he's fallen. He's hit his head also. He's bleeding from the head as well, right? What do you do?
Call for help first.
Okay, so you're by yourself, right? Who do you call for help? You take your phone out, or you
Yeah,
tell
I
another
call
person out there?
1990.
Okay. Okay, right.
Yeah.
Okay.
And
1990.
maybe I
Dialing
can,
19. You're dialing
maybe I
1990.
can,
Okay. Yeah, maybe you
um,
can.
shout out for help if someone could help me.
Yeah. Okay. So there are a lot of people. You can easily ask for people's help. So they'll be
Okay.
like, okay, people will come. So are you going to give it to them? So now, what are you going to tell them? One person has to act as if, let's just imagine that you are a first aider. You have
Okay.
this so some knowledge. The other people don't have any knowledge. So what are you going to do? So you're calling for help. So you told them that we need to do something about it, and you're on the phone with 1990. So let's just imagine I'm the operator. Hello, how may I help you?
I'm supposed to tell him that there is an unconscious
No,
man
no,
lying
you're
on
not
the floor.
supposed to. You're not supposed to tell him. You're supposed to be there in that situation, and I am actually the person on the listing. Don't go on about talking in third person. Imagine you being there. Understood? So
Okay.
talk to me. Talk to me. Tell me what exactly you see.
There is an unconscious person on the floor and the nearest police station.
Yeah, where is the nearest police station? Make it up. Let's just say where do you live? Maybe you went to
In
your
front of,
nearest Cargills. Nearest
yeah.
Cargills. Okay, so you
Sorry?
tell them that okay. Yeah, so wherever your location, you tell them okay. I will ask you, is he all right at the moment? What exactly are his injuries?
He is bleeding from his leg and he is unconscious. Is he
He's
unconscious?
unconscious. Have you gone to see madam?
Sorry?
Have you gone to see the patient? Is
Yeah,
he
I'm just
bleeding?
besides him.
Okay. Okay, right. Okay. So we will send an ambulance in 5 minutes. All right. Now what are you gonna do?
Now maybe I have to stop his bleeding. Maybe they tie
Okay.
that.
Right.
Uh,
So
uh,
he's still in the road. So the vehicles can also knock you down. Is it
wait,
okay?
I can do DRABC.
Yes, exactly.
Yeah.
Always start with DRABC, or you can put CDRABC. Call for help, danger, response. Right? Yahweh, breathing, circulation. Call for help, danger, response, Yahweh, breathing, circulation. Okay, so now danger, right? So you put him on the side. Okay, great. Next.
And now maybe I have to talk to him or keep my hands on the shoulders and see
Yeah.
if he's talking, if he can
Okay, so
respond.
he's not responding.
Okay, now then I have to see if there is something blocking his airway.
Okay,
Or
so
I
what are
have,
you gonna do?
yeah, I'm going to do that head tilt, jaw thrust, and chin lift
Very
manual.
good, right? Okay, so there is no vomit or there is no foreign bodies in his mouth.
Okay,
His tongue also like looks to have not obstructed. Then
then I have to see if he's breathing.
how are you going to check that?
I'm going to do the look, feel, and listen process.
Yeah. Okay, right. You see that he's not breathing as well,
Okay, now maybe I can feel his pulse near the in his neck. No,
which is called the carotid pulse. Okay, you feel a
and if that
pulse.
okay, and then maybe I can start CPR still.
Even if you feel a pulse.
Yeah, because it's not going to affect, right? So maybe I can
Mhm.
do that.
Yeah,
No.
basically remember this. Okay, when you find a pulse, you don't have to do a CPR. If there is a pulse, that means the heart is beating on its own. You get what I'm
Okay.
trying to say? If there is a pulse, if you feel a pulse, it means the heart is beating. Obviously, if the heart is not beating, then there won't be a pulse. You understand? Because the blood is being pumped into the brain because the carotid is going to the brain, right? The neck artery, the neck pulse that you're feeling is an artery that is going to the brain. And if you feel a pulse, it means the heart is beating and sending blood to all the parts of the body. So why do you want to disrupt that process? Because when you carry out CPR, you might break ribs, you know. So it's going to be a lot of hassle. If there is a pulse, don't. If there is no pulse, yes, you should. If someone is having gasping breathing, right, just like is breathing something like that, like it's called gasping breathing. Still, you need to do CPR. But if there is a pulse, if there is ever a pulse, don't do CPR. Okay, right?
Okay.
But there is no harm. There is no harm. As a first aider, you feel you're not sure. You're not sure if that is a pulse or it's just your fingers, right? If you're not completely sure, go ahead, do CPR, right? But if you're sure that the pulse is there, then you don't have to. You understand? So it's all about how confident that you are, right? So let's just say that he has a pulse and you've decided not to do that, and the ambulance is around 2-3 minutes away, but he's bleeding
Then
from his head and he's bleeding from his head and the leg. What are you gonna do?
then maybe I should put him to the recovery position.
Okay, you can put him to the recovery position, the left lateral side.
Yes, and the leg into 90 degrees.
Yeah, okay.
And then maybe to stop, now I can try something to stop his bleeding, right?
Very good. What are you gonna do?
That you can tie something above the injured position so that it would
Yeah,
stop the.
tourniquet. You can. But before that, is there anything else? Just use whatever. If someone can offer a handkerchief or something, you just press that area, right? You just press that area and keep. Direct compression. Just apply direct compression. So someone can press on the head, someone can press on the leg. Until that, you can actually get the you can wait for the 1990 people to come. Very good, very good. Any questions so far? Did everyone understand? I want to do seizure, but I don't think seizure can be done because it's going to take more time. Any questions? Right. So now you're gonna have homework today, right? Take out your pens and pencils or whatever and a paper.
Excuse me, sir.
Yeah, go on.
So I wanted to know that if we are doing the CPR very forcefully, does it affect the patient?
Yes. Now, basically, when you do CPR, right? I remember when I learned how to do CPR, my consultant told me that how do you know if you're doing effective CPR, right? So I kind of told you all, right? How do you ensure that there is effective CPR? One, you make sure that there is you do CPR at a rate of 100 to
100 to
120,
120.
right? 20, right? That is your rate. That means 100 to 120 per minute, right? So per minute you need to have compression relaxation 100 to 120 times. Second, it should go at a depth of 5 to 6 centimeters, right? Or one third the chest cavity, right? One third you need to press, right? Third, my consultant tells me that you need to break ribs. If you hear the sound of you that I don't know, y'all have never heard, but when I do CPR, I hear, I hear the noise of ribs breaking. So, which is again a sign that you're doing CPR well, right? But if if you do it too much, if you go around 7-8 centimeters, press way too much, yeah, you might cause lung contusions and all of that. But at that moment of time, it's not important, because at that moment of time, what's important is to make sure that there's blood being pumped around the body. So if you break ribs or you cause lung contusions, not to worry, but you should understand that you should do it according to these things. You should not press too hard. You should do it at a rate of 100 to 120, and you should not you should not give too much of force, right? So these are all things that you can actually abide with, but it doesn't matter. It doesn't matter if you still do it violently. As long as you do it at a rate of 100 to 120, you have time for relaxation, and you press it 5 to 6 centimeters. That's enough. But if there are any other things also, it's okay, because at that moment of time, all you are thinking about is making sure that his heart is actually pumping blood, right? Any more questions? Right. Have you all taken out your a book and a pen? Because I'm going to ask you all some questions and I want you all to write it down. So it's like a summary of all what you have done. Okay. First question. What is the definition of first aid? Second question, what are the 3 P's of a first aider? Third question, what is the emergency hotline ambulance service in Sri Lanka? Fourth question, what are the 4 components of the survival chain? Fifth question, what is the mnemonic that is used to assess a patient on the ground? The DRABC. Explain in detail. Fifth, yeah,
So will you please repeat the last question?
yeah. What is the mnemonic that you assess when a patient is lying unconscious on the ground? Explain in detail. How do you check, question number 5 or 6, I think. How do you check if a patient is responding? How do you check if a patient is responding? Question number 7. How do you assess if the Jave is patent? What is the maneuver that you do to improve the patency of the Jave? What is the maneuver that you do to improve the patency of the Jave? Next question, how do you check for person breathing? How do you check, next question, how do you check for a pulse? What are the pulses that you can check? Now this I will teach you all next week, right? What are the pulses that you can check? So I've only taught you about carotid pulse, but I've teach you about all the other different types of pulses that are there. Okay, so how do you check for a pulse, and what are, that is one question. The next question is, what are the pulses that you need to check? Just remind me. Okay, and I will teach you. What are the pulses that you need to check? What are the pulses that you need to check? Next question, how do you ensure that good cardiac massage is being followed? Last question. When do you stop CPR? Any questions? So I want all of these questions, the answers, I want you all to actually write it down, and we will discuss all these questions next week, right? So before we start, I will teach you all about all the different types of pulses that are there. Or I think we can, if you all don't mind, we can do it now itself, right? Let me just quickly get a blank screen. Yeah. Right. So right, so there are lots of pulses that a person can have, right? So the one that we checked is the carotid pulse. Right? In the foot, there are two. There is one close to actually at the foot itself, at the rear between the first toe and the second toe. That's called the dorsal pedis, right? Dorsal pedis pulse. And then at the medial aspect of the leg, you have a posterior tibial pulse. Then in the knee joint, in the posterior aspect of the knee joint, that is at the back of the knee joint, you have something called a popliteal pulse, right? And then,
Hi.
yeah,
Can you just be a little clear when giving us the anatomical names of the parts of the body, please?
okay, right.
Thank
So
you.
first of all, let's start off with the dorsal pedis, right? The dorsal pedis is actually the one that you actually have in the foot, and it is between it's between the first toe and the second toe, around 1 to 2 centimeters from the base of the toe, right? That is called dorsal pedis. It's called a dorsal pedis artery, so it's called a dorsal pedis pulse, right? The second one, when you take the foot, right? Now I'm gonna draw it, right? So you all know what lateral and medial is, correct? What is lateral and medial? Right, so let's just say that this is the medial aspect, right? So it's the right side. So this is called the medial. So there's a bone called the medial malleolus, right? It's a very prominent bone on the medial side. You can actually feel it. It's in the leg. It's in the distal aspect of the leg, right? Just behind it, right? Just behind the medial malleolus, you can find the posterior tibial pulse. Okay, just behind the medial malleolus, right? Uh, the third pulse which I was talking to you about was the popliteal pulse, which you find at the posterior aspect of the popliteal fossa. Where is the popliteal fossa? It is in the knee joint. If you have the knee, right, the joint, and not in the front, at the back. Posterior is back. At the back of the knee joint, if you go in the middle and you feel, if you press deep, you can actually find a popliteal pulse. Okay. The third pulse, the fourth, is the femoral pulse. Right now, femoral pulse you find in the groin. Now, I can't actually tell you the anatomical landmarks because you all don't know, but it is in between the anterior superior iliac spine and the pubic symphysis. But just remember, it's in the groin, right? Because obviously it's in the groin. If you feel the groin, like how I can tell you is, you will feel a prominent bone on the pelvis, right, on the middle of the pelvis, right, and then on the lateral side. I think this is just let it be because it's too much for you all, right? Remember, forget the femoral, just remember the femoral pulse is another pulse that you need to see, right? Then you have on the face, right, on the face, right on top, like in a sense, on the lateral margin, or, hello, yeah, can the others unmute please? All right, so the is called the superficial temporal artery that is medial, right? Medial lobe, right? It is more closer to the temporal area. Right now, that is right. The temporal area is somewhere here, right? So this is where you feel a pulse, right? So it is medial to the earlobe, right? And if you press, if it goes in the direction which I've drawn, it's a temporal artery, STA, superficial temporal artery, or the right. I've already discussed to you about the pulse, right? Then you have in the medial aspect of the elbow joint, aspect of the elbow joint, right? Medial aspect of the medial joint. Then you have the radial, the ulnar pulse. I'm sure you all have
I'm
heard
sorry,
about
your line is breaking, sir.
lateral radius, and I'm you can tell
Excuse me, sir. Can't hear you properly.
sorry about it. So basically, the pulsars, I will actually discuss it again. I will actually get an image, right? A proper image from the internet, and I will show you also that it makes more sense because there are different landmarks that you use, right? One landmark is the skeletal landmark using the bones. So I think it's better if I have a slide next week, right? I will actually have a slide so that it is much easier for you all to properly with regard to the bones and all. It's easier because normally what I do is during the practical classes, I show you all when it comes to the we get the skeleton over and I show you all according to the skeletal anatomical landmark. So it's much easier for you all to remember, right? So doing it online is very difficult because this was just an additional thing that I wanted to teach you all. So what I'll do is I'll actually next week, what I'll do is I'll actually get a slide of the whole skeleton, and I will try to show you all, mark it on the skeleton itself where you can feel these pulses, right? So for now, that's it. Are there any questions? Any questions?
No, sir.
All right. So then I'll see you guys next week. So next week we're going to start seizures, right? We're going to do seizures. We're going to see what will happen, what we will do when a person is when a person brings a completely chopped off arm. What do you do? What can you do if you're there? If someone is bleeding severely, what do you do? So we'll go into those things. If someone is having a heart attack, what do you do? Things like that we'll actually discuss next week. All right, so make sure you do your homework, which I've been given you, because I was told that I need to give you all assignments. This way we can actually maintain if who are the people who are continuously coming for the classes. It's a sort of a way we can assess. And this class is recorded, so if you want to re-watch it, or if you want to re-look at whatever was discussed, you can speak to your counselors and get the class. All right. Thank you very much. Hope you have a very good weekend. Take care. Bye.
Thank you, sir.
Thank you, sir.
Thank you, doctor.